Hey everyone, this is Jason from Intricate Art Spine and Body Solutions. You can check us out at intricateartseminars.com. I just wanted to talk to everybody today about mastectomy scars, and I just wanted to read a text that I just got from a past student that had just treated a mastectomy patient with dry needling for the first time. She said, "I'm so excited to tell you that I dry needled a mastectomy patient Tuesday. She had immediate softness under her arm. She came back today and told me after 10 months of dealing with swelling, she was able to wear a bra and sleep on her stomach. She called her doctor to let her know how great it worked. The magic continues. Thank you. Keep on teaching." So these are comments that I get all the time from my past students, and they're things that I see all the time when treating my patients. So dry needling is such a potent tool to change the brain, and it's very, very undervalued. So the reason that dry needling can accomplish such amazingly awesome results, and it seems like freaking witchcraft a lot of the time, is that it's a direct, specific enough stimulus to the tissues in the body that it changes the brain and it breaks the brain out of this sympathetic protective barrier that has placed itself in, right? So the body protects itself from trauma and pain by elevating the sympathetic autonomic nervous system. And a lot of the time with seriously involved surgeries like a double mastectomy or a hysterectomy or anything like that, if your body is not in awesome health going into it, that's going to put you into an energy deficiency, and then your body's going to start to malfunction in all sorts of different ways. So one of the most common things that I hear from my post-mastectomy patients are problems with swelling in the upper extremities and pain, right, in the armpits and the arms and stuff like that. And it really causes a decrease in range of motion in the neck, right? Because if you think about putting a bunch of like clips over your chest here, that's going to pull all your skin down, and it's going to cause your neck to go into flexion. Then you're going to have to try to extend your neck to look forwards, and it's going to cause foraminal stenosis in the neck. It's going to cause all sorts of problems. So one of the big issues with mastectomy scars is, if we picture a scar across here, the stellate ganglion of the sympathetic chain sits right in front of the first rib here. That's our upper extremity sympathetic autonomic control center, right? People do stellate ganglion blocks. Regular doctors do stellate ganglion blocks to regulate abnormal heart rhythms, to regulate PVCs, arrhythmias, right? So the stellate ganglion, if it gets hyperactive, gets really, really problematic for the autonomic nervous system because it directly stimulates the sympathetics to go up, right? So if you scrunch all the skin in the front here, that's going to pull on the neck muscles, it's going to pull on the neck fascia, and it's going to put abnormal stress on the stellate ganglion for a number of reasons. One, direct abnormal stress. Number two is, once you change the orientation of the tissue in the chest, you're going to change everything in the neck, and C1-2 is going to deviate to compensate for any other rotation in the spine that happens, right? So C1-2 is the most mobile segment of our spine. It's got about 40 to 45 degrees of rotation in either direction, right? So C1-2, one segment, makes up 50% of cervical range of motion, more or less. And then the next most segment as far as rotation goes is like 14 or 15 degrees, and that's in the cervical spine. And when you get out of the cervical spine, it goes down to like 5, right? So just mechanically speaking, it's the easiest for our spine to self-compensate at C1-2. Now, an issue with that is that the middle scalene goes from the first rib to C2, and it attaches another vertebrae in between, right? If you get excessive tension on the chest here from a scar, and the scar uses the autonomic nervous system to heal, right? So that's going to aggravate the autonomic nervous system. So you have a bunch of pain receptors, chemoreceptors, abnormal concentrations of substances and proteins in our body that are all getting congregated in the chest here. And that is going to put abnormal tension on the scalenes. The scalenes are going to get mad, and when the scalenes get mad, it's either going to deviate C2 and or pop the first rib up out of place. And the problem with the middle scalene is that it's like the opposite muscle to the quadratus lumborum. So the middle scalene goes from the first rib to the second cervical vertebrae, right? The quadratus lumborum goes from the 12th rib down to the iliac crest. So if both of those muscles are tight, they basically are opposing muscles on the rib cage and they'll pull against each other. So upper cervical tightness starting up here from a mastectomy scar is going to cause the middle scalene to get pissed off. That's going to deviate C2 in the first rib. That's going to cause the quadratus lumborum to get pissed off. That's going to pull on the 12th rib and the pelvis. It's going to cause all sorts of disruption in the sacral plexus, which is a parasympathetic dominant area of our spine. C1, 2, 3 or C1, 2 is a parasympathetic area of our spine as well. So then you end up getting both parasympathetic areas, the sacrum and the upper cervical spine, pissed off because of abnormal tension and trauma placed to the chest. So going in and needling the cervical muscles, the multifidus, targeting the structures around the stellate ganglion, the psoas major muscle, which can pull directly on the sympathetic chain, and then needling the scar tissue itself over the chest is extremely important. So brand new scars, I like to put as many needles as I can. Sometimes I have 100 needles in a scar across the chest. And like that comment that I read you guys before, I have people that have had swelling in their upper extremities post-mastectomy for years and years, and after a couple of sessions of needling, the swelling goes away. And the reason is the swelling is there because the sympathetic autonomic nervous system is too hyperactive. That's going to constrict the muscles. It's going to totally shut off the lymphatic vessels. It's going to open and foul up the venous valves. The blood is not going to flow normally. Lymphatic fluid is going to stop flowing, and there's going to be all sorts of problems. So needling kind of stimulates a reconnection between certain areas of the brain and certain areas of the body because it's a specific enough stimulus with the needle directly to the tissue. So aside from treating the scar itself, it's always important to target as much pathology throughout the body as you can, along with the parasympathetic autonomic nervous system, because remember, the overall goal is to push the autonomic nervous system towards homeostasis, which typically involves depressing sympathetics and elevating parasympathetics. That puts the mind and the body in their best position to use their innate healing abilities that they've been inhibited from doing so. It's not that the brain and the body forget how to function after a mastectomy. It's that it puts the autonomic nervous system into a state of dysregulation, which causes all sorts of other widespread problems, including incontinence, headaches, all sorts of stuff. So if anybody out there is having issues with mastectomy scars, find somebody that has been taught by us in dry needling. You guys will have great results. You can check us out at intricateartseminars.com. Check out my blog page on our website. And if you're watching this on YouTube, you know where to find us. Thanks.